Welcome back to BLOCKTV, and you're watching Links in the Chain, where we get to know the people creating innovative solutions that the world needs using blockchain. It's no secret that the healthcare system has a few kinks that need to be figured out. A company working to figure it out globally is Solve.Care, with the mission of, according to the company site, make healthcare work better for ourselves, our parents, children, society, business, and the global economy. Joining us via Zoom to break it down is Pardeep Goel, CEO of Solve.Care. How are you, Pardeep?
Very well, thank you. Pleasure to be here.
Thank you for being on with us today. It's truly a pleasure. Now, kind of getting into it here, let's start with the problem. What is faulty within the healthcare system? As you see it, I know you have a background in what you have called in the past the evil side of healthcare, if I'm not mistaken, being insurance. So if you can get into that problem, that would be great.
Well, thank you again for having me. Healthcare is a complex field, and there are many fundamental drivers for the complexity, but fundamentally, it's a team sport. You cannot deliver healthcare as a transaction. It's a journey. So if you think of every healthcare episode as a journey, many people are going to get involved. The patient, the doctor, the family member, the specialist, the pharmacist, the lab, the insurer who has to pay for it, or government or employer. Somebody has to pay for healthcare. And all of these people have different roles, and they are important and essential roles in most cases. However, these roles also are orthogonal to each other. We don't necessarily have the same objectives between as a patient versus a doctor versus an insurer. It should be patient-centric, but business interests, regulations, and the role that people play lead into this very different and orthogonal model where we don't have the ability to trust each other. Whoever controls the data controls the process and the outcome, and that's not always in the best interest of the patient or the process. So what we are seeing in healthcare is that these fundamental structural barriers have been existent for so long that we have taken them for granted that that's the only way it's going to work. And with blockchain, of course, we are challenging that assumption model and saying this is not the way it needs to work. It can be different, and we can collaborate and cooperate without giving up our individual roles and responsibilities.
Absolutely.
And that's the fundamental premise.
Right. So you got into a bit of the solution here, but before we get further into that proposed solution of Solve.Care, there is, this platform, and within it you have the Care Wallet. There's a little explainer video on your site, and I would like to show a piece of that just so we all get the idea. Let's take a look.
Tell a different healthcare story with Care Cards, a Solve.Care storybook. Sasha has new insurance for herself, her daughter Michelle, and her son Raymond. She bought her plan from Best Health. Insurance is hard to understand, but this time Sasha feels it will be different. This time, Sasha has a Care Wallet and knows everything about her insurance plan and benefits. The answers to her questions are easy to find. She understands who she can see and how much it will cost. When Raymond became sick, Sasha found a good pediatrician faster than you can blink. Sasha requested an appointment through her wallet, and the Best Health team found her a perfect option within minutes. She also received a ride card, which she uses to take Raymond to the doctor. Wow! At the doctor's office, all she has to do is show her Care Wallet. She doesn't even have to make a payment. After the doctor checks Raymond, he gives him a prescription. Sasha keeps in sync with the pediatrician by reporting Raymond's progress in her Care Wallet. After 3 days, the pediatrician notices that Raymond isn't getting any better and refers him to a specialist. Sasha picks the option that works best for her and Raymond, and the appointment is confirmed instantly. Raymond is better now. Sasha is amazed at how well he was taken care of and is very thankful to have Best Health on her side.
So we have an idea of what the solution is here, but how is Solve.Care the solution? And then you touched on this at the beginning, but why blockchain?
So what you saw today is what we call a specific network. In Solve.Care, we can design very specific networks for populations, for countries, for hospital systems, for insurance companies. The objective here is to design a network that serves the patient and the care team around the patient in the best possible way. And that is subject to so many local and regulatory and process requirements that one solution will not fit all. Our platform is designed to use blockchain as a coordination fabric. We use blockchain in a very creative way. And the objective here is to use a distributed ledger to keep all the parties in sync and to allow each party in this care journey to understand and act upon their role and their relationship with other parties. And we can monitor, manage, and enforce the right relationship and the right behavior across all these players, be it the patient, be it the doctor, be the administrator, be the payer, be the government, and so on. To achieve that, we built a platform which uses blockchain. So we are not just a blockchain. We are a very robust healthcare administration platform that takes the best essential value of blockchain and then layers in all the necessary consent management, security, access, role, and relationship management. And now we have a platform on which you can launch a disease-centric network. You can launch a insurance-centric network. You can launch a population-centric network. You can launch a patient-centric network. And these networks can intermingle with each other. But the fundamental value is that I, as a patient, now have absolute transparency and control over what is being done for me, by me, what my family members can do, what I can do, what my doctor should be doing, what my insurance company should be paying for. That transparency gives me the ability to be an engaged, informed participant, as opposed to being a passive recipient of healthcare. And that's true in the US, that's true in Asia, that's true in the Middle East. And that's why we are so excited about what we are being able to do already in the healthcare transformation.
So recently, within this transformation of healthcare, you guys partnered up with Uber Health Transportation Service, integrating the Care Wallet. What does that relationship, that partnership entail, and how is that beneficial, to Uber Health, integrating Solve.Care's solution?
So from our perspective, we are enriching the Care Wallet so it is of greater value to the wallet holder, the patient first and foremost, physician and other care team members. Now, from a perspective of integrating transportation, we see it as a fundamental part of the care delivery model. Transportation plays a role in who can get care from whom, how far they can travel, can they afford the visit, do they miss the visit, is the physician going to have to reschedule them 3 times, can they refer them to the best specialist, or do they have to refer them to the closest specialist? There are many reasons why transportation, if properly embedded in the care journey, can actually produce the right outcome. So our vision in integrating Uber is essentially like your expectation of having a camera in the phone. We are integrating essential healthcare services into the wallet. So the wallet's capabilities allows the patient to have the maximum control and abilities to take care of themselves. So be it transportation, be it telemedicine, be it online pharmacy purchases, be it the ability to manage your records or give consent to your family members to speak on your behalf. These are fundamental capabilities. So if I can give you the iPhone analogy, iPhone is supposed to let you make phone calls, but today we use it for texting and for photos and for videos and for reading books and so on. Those are essential qualities of the phone that makes it much, much richer in how it serves us. So we are taking the same analogy, applying it to Care Wallet. We are enriching the Care Wallet with fundamental capabilities that in the hands of a patient become very powerful when applied to the healthcare model. So we are bringing into the Care Wallet essential services like consent management, record management, transportation access, pharmacy access, and so on. And we will keep evolving this product. When our clients leverage this Care Wallet to launch a care network, they can count on these core capabilities to be always present. So as an insurance company, I don't have to worry about all the basics. All I have to do is to design the network that will serve my patients the best. And I am off and running to the races, and my cost of launching a network is a fraction of building a custom solution. So we are essentially bringing a model not dissimilar to Apple App Store or Google Play to healthcare in the form of Care Wallet and care networks.
I think that analogy is the best way to explain it. Was that something you guys came up with for, I'm just curious here, this is a sidebar question, for the millennials among us to get the point quicker, or was it just the best fit as an analogy?
Well, I think it's a little bit of both, but I think most of my team is very young and they are our perfect test ground. And I'm very proud of what they're doing, but they certainly bring these analogies to bear, and this makes total sense. It was a coincidence, but it's also very appropriate.
Absolutely. Now, recently, we mentioned that you are a global entity, recently announced the move of the global headquarters to Singapore and legally incorporated in the country. What is the significance of this move?
So we recognized early on that we're going to have a significant footprint in the US, where I grew up in the healthcare space and it's home. But we also started to see the potential of the Care Wallet around the world. And we were quite surprised at the speed at which we saw the interest develop around our product. And when we look at our mission is to get the Care Wallet in the hands of every man, woman, and child who needs it when they need it. It's a healthcare application that belongs to the patient and is theirs forever. This doesn't belong to an insurer. It doesn't belong to a hospital system. Care Wallet is yours. It is independent of who you are insured with, where you live, who your doctor is, who your employer is, and so on. Once you use it for life. And our vision is that Care Wallet should be in the hands of everyone, particularly those struggling with chronic diseases or struggling with taking care of their parents or their children, because we always tend to take better care of others than we take care of ourselves. So our vision here is Care Wallet in the hands of those who need it. And when you look at the growing propensity of diseases in the highly dense population areas of Asia, it makes total sense for us to focus on that market in addition to the US and Europe that we are already focused on. And for us to be relevant in Asia, we have to have our feet there. We need to understand the local dynamics. And Asia is not homogeneous. Australia is different than China, is different than India, is different than Malaysia, and so on. So what we decided to do was to expand our vision to say, there's a high density of disease and population in need, and there are more diabetics in India than there are people in Canada. We need to be present in Asia in addition to serving the well-developed nations. And we decided that our presence there must be more than a few people or an outpost. So we decided to relocate the headquarters there and to make sure that we have a center of gravity that allows us to develop the vast population density there, which we can address through the Care Wallet and bring really compelling value to them in a different way than perhaps we bring it in the US, but we can affect billions of lives in short order. And that, of course, serves our mission really well.
I mean, that goal is, getting to know your market. It's very sensible and brings me into the perfect segue with how does the solution work practically for the average Joe in terms of onboarding? So roughly how many members and healthcare providers are currently using the platform? Is it a struggle? In your experience, what is that onboarding process like?
So we are a B2B2C platform, which is a fancy way of saying that we give our platform to our clients to design networks. Our clients can be insurance companies, self-insured employers, government agencies, large hospital systems, clinic systems, pharmacy systems, lab systems, and so on. And they have a population they serve, be it a patient or an employee or a citizen or a hospital admitted patient and so on. And their population is the one that downloads a Care Wallet and uses it to connect to the network that they have sponsored. So today, our adoption is driven by our client requiring or educating or mandating or facilitating the adoption of the wallet by their population. We do not go directly to the consumer offering them the Care Wallet. We give it to them through the sponsored network of our clients. So that makes adoption much easier in some ways because our clients have clear communication channels and clear financial and procedural and administrative incentives that they can offer to the Care Wallet holders, which is a reason why somebody would download and use a Care Wallet. And once they use it, they see the value of it, they're going to stay with it. The twist, however, is, and this is really innovative, that once you download the Care Wallet and start using it to connect to, say, your insurance company network, the wallet becomes your asset. Even if you cease to be a member of that insurance company, you will have the wallet in your hand with this resident functionality that you can still use. And you can use it to connect to another network, which you may connect to because you have a certain propensity or predisposition to a disease. So the wallet in your hands as the patient is your asset, regardless of who sponsored it. But once somebody has sponsored it for you, you have lifelong residual value from it. So to us, it creates this network effect, which is really powerful, where business sponsors a Care Wallet and the consumer retains the wallet to access many more services than the one that was sponsored initially. So my insurance company may give me 3 care cards, but I may after I have left that insurance company, or even while I'm still a member, regardless, I can download 10 other care cards that I feel are important to my family and continue to use them even after I have ceased to have insurance with that particular plan. So it creates a very powerful network effect between me, my family members, my physicians, and my payer, which could be government, employer, insurer, or myself. So these are the intersections that drive our adoption. Now, in terms of the number of doctors and patients, each network is different. We have a provider rewards network operating in Arizona for the last couple of years. We're launching a diabetes network, which will go over the next few years global, allowing any parent or any diabetic to know how to manage their diabetes effectively, measure their symptoms, report their symptoms, and have the ability for physicians to give them second and third opinion and to measure their progress against the best possible care models that exist. So I could be a parent living in Malaysia and compare my child's care model to the best prescribed care model, say, coming out of Harvard. It breaks down the barriers. It breaks down the geographic, economic, and access barriers, which is the number one reason why people don't take care of themselves, because they don't know, and they don't know how they stack up against somebody who might be getting much more efficient care. So the whole idea of Care Wallet is I can sponsor it for you, but once you take it, it's yours. And from that vantage point, you can access as many networks as are relevant to your families.
Right, so it's going back to that theme of, as you were saying, you know, this is the theme of especially this interview, but I believe of Solve.Care is you have the power, you as the patient, you as the user. Now, going off of that theme, that is what blockchain is meant to be, right? That is that ideology. So why do you think that the healthcare industry, which many would argue is the top use case of blockchain, isn't adopting blockchain solutions at a faster pace?
Well, look, there is good reasons and not so good reasons why it takes time to change anything in industry. Healthcare industry is complex, it's highly regulated, and it also has, you must not do any harm. Any changes in healthcare, you have to ask the question, am I legally allowed to do it? Will this have any negative impact that I haven't thought about? Will the other care team stakeholders, be it the physician or the hospital or the pharmacy or the lab or the patient's care team or patient's family members, who will have an adverse impact on this? Why would they join this? And what is the business interest that they might be compromising in joining? So you have to think through all those things. Now, that being said, that's the reason everybody always gives why change in healthcare is slow. But the real reason is that there has not been very, very good, well thought out solutions that do address this problem fundamentally. And if you really apply blockchain in the right way, beyond just the blockchain as a DLT, as a distributed ledger, if you build a platform on it that addresses my regulatory concerns, my legal concerns, my separation of data and ownership concerns, if you make sure that there is consent and access control, and that transactional costs are lower, and that I am not going to be held liable for things that I shouldn't be held liable for, if you carefully answer those questions, then the business will adopt it. And we are a proof of that. We are getting adoption, not just in the US, but in Asia, in Middle East, in Europe. And we are getting that adoption because we answer these questions that every executive has in healthcare, whether it's on the payer side or the delivery side or the administration side. You have to answer the questions, will I do any harm? Will I be at harm? Will my business interests be adversely impacted? And what we have found is, if you will, threading the needle, that the network design that you can do on a platform is able to realign people's interests, be it the pharma interest or the lab interest or the insurance interest or the government interest, with that of the patient. And that's the greatest innovation of all, that you can create network designs that don't need to put people in an orthogonal relationships to each other, but alignment with what is really what we are after. Get the patient well in the most optimal time frame, at the most optimal cost and utilization, and keep them healthy. And that is a very complex equation. So yes, it takes time, but at the same time, we are very pleased with the velocity and the speed at which our clients are seeing the blockchain and our platform as a transformative engine. And every single day, we are presenting to all manners of clients, be it lab systems or hospital systems or pharma companies or insurers or government agencies who have expressed strong desire to apply a platform like ours to changing the way healthcare works. But it is going to take time in the macro sense. Nothing this big when you think about healthcare being an $8 trillion industry, roughly, it's a massive part of the global GDP. We are certainly not going to change it in a day. I tell my team this all the time. We have begun a journey that will not finish in my lifetime. But you and millennials you spoke about, my team here, they're going to have to carry on this mission. No matter how big we get, there's going to be a bigger mission ahead of us. There's going to be more people and more business programs that we can change. So I do think that this is a journey that will take decades, but this is a journey that's worth taking. And along the way, we will make incremental and significant impact on humanity. And that is something worth fighting for.
So we're saying slowly but surely, and most importantly, carefully and ethically, is what I'm gathering and summarizing here. Now we spoke about Uber Health transportation integration. We spoke about the move to Singapore. What's next for Solve.Care?
So we are looking at more strategic partnerships beyond Uber and Lyft. We are seeing partnerships around telemedicine get very serious. We are looking at pharmaceutical partnerships that are becoming very, very important, and they are turning into a meaningful impact and meaningful value for the patient. We see ourselves expanding our offices into the Middle East and into Latin America. So there is considerable expansion underway. But again, like the business model, the company must be managed carefully, ethically, and with discretion. So we see Solve.Care really getting started at this point in time. But we think our success should be measured in terms of how many lives we impact, how many people we help take care of themselves and their families. So the real metric that matters is not how many offices we have and how many clients we have, it's how many people we serve and how many people we help and empower to take care of their healthcare. And in that regard, we are literally just getting started. We have the entire planet to serve, and we have just begun in a few countries at this point in time.
Thank you very much, Pardeep Goel, CEO of Solve.Care, for joining us and breaking down how blockchain can help within the healthcare industry, particularly your platform. We thank you for joining us, and we thank everybody for watching us at BLOCKTV.com. And for all you folks at home watching, keep on watching for more cryptocurrency and blockchain-related news.
For more news and updates, follow us on Twitter.